What's up, guys? My name is Adrian. I am a male CNA and I work at the hospital. I've been there for about a year and I wanted to share in this video what it's like to be a male CNA. I don't see a lot of people posting content about what it's like to be a male CNA. I see a bunch of male nurses posting stuff, but a CNA and a nurse aren't the same thing. So, um, anyways, yeah. I got my little girl with me. She was taking a nap. I thought I'd be done by the time she woke up, but we're not. So here we are. Say hey, Everly. You gonna say hey, honey? She's fixated on my watch. But anyways, I got like 5 things I want to share that I think would be important for you to know if you were to ever consider this as a job for yourself. And a little bit about me, I'm in school for nursing and I'm pretty pumped about finishing up so I can get in there and start helping patients in a different way than I already do. Um, let's get to the 5 things. First thing I think that would, be very important to know is that you're stepping into a female dominated atmosphere. A lot of CNAs and techs and nurses are women, so don't take it personal when things are said that just go over your head or they want to exclude you from certain conversations. That's just how it is, man. Just roll with it, do your thing. Realize that your presence is a blessing. If you allow it to be, you can, bring balance to the shift. There's a lot of perspectives that men bring to the table that are different than women. There's ways that you guys can help just by being, calm and reserved and, cool under pressure. And I'll give you an example. A lot of times I've noticed, my female colleagues get flustered with a lot of admissions. The other day, the charge nurse kept it, apologizing to me because she had to give me like 5 admissions back to back, but I was fine because I just got 5 discharges. So that's just the way of the hospital in terms of, patient care. Sometimes we get a bunch coming in and we get a bunch leaving, and it just happened that it was my patients that were leaving and coming. But I tried to keep my cool and composure, and for that, I was recognized as someone who, for the most part, is easygoing. She was like, it makes it so much easier when, you guys are just like, hey, I'm a team player. I'll do whatever, take how many ever patients I need to. Now, obviously, you don't want to take too many to the point where you can't take care of them. But I think you understand what I mean. Taking your patients and just being a team player, it helps the flow of the shift. It brings balance. Second thing I think you would need to know is that some patients are going to prefer females. That's not a knock at your character. They're not trying to call you a pervert. Some women are just going to prefer other women. And my advice to you would just be to shake it off and, go on to the next patient and treat them with the same amount of care. I get fired all the time. I say fired loosely. I mean, they just prefer a woman. So I say, hey, we'll just switch the assignment up. That's okay. And before I even bathe or touch a woman, I will ask, are they comfortable? I won't just assume that they are okay with it. Now, in certain cases, a person's so out of it and unable to take care of themselves, you just go in there and bathe them. Now, I have chaperones. I have women with me to make sure, I'm protected as well and for the protection of the woman. That's just something that comes with this job. Patients are just going to prefer other women. So don't let it bruise your ego. It's about their comfort at the end of the day, not your capability. So yeah, that'd be my second tip to think about. And your strength is a blessing, honestly. Your female colleagues are going to be asking on you, but your gentleness is what builds trust. They'll call you into a room for a boost and you can come in and be like macho nacho, I can boost anyone on this floor. But the way that you deal with your patients and your tone, and how calm you, remain in these situations, your gentle hands is basically what, stands out far greater than your muscles. So that would be my third thing. Think about your strength as a blessing and not something that you just throw around. Fourth thing would be, your documentation and time management will either make or break you. Most new CNAs on the job, they're hands-on and that's all they can think about. But, safety checks are just as important, and, learning to chart quickly and accurately is going to be, to your advantage. And that's something that you can bring to the table that can also help the team out and free, you being free because you're caught up doing your safety checks can help with other things on the floor. And I've noticed on plenty of occasions where I'm caught up, I'm free to help my other female colleagues. So, keep that in mind. So that would be the fourth thing. I got a 6 point. It's gonna be a bonus, but yeah, it keeps your patients safe, and it keeps your nurses trusting you. So yeah. Fifth thing would be, just know that you're not just a CNA. You're the eyes and heartbeat of the floor. Any subtle confusion, new pain, decreased appetite, odd skin color, changes in mobility, mood shifts, a patient seeming lethargic, nurses depend on their CNAs, more than you realize. And, a bad CNA or a good CNA can make or break a nurse. So just being on point and, literally speaking up to recognize your voice is protecting someone's life. Never underestimate that. So that's pretty important. There's been on plenty of occasions I've caught blood sugars that ended up being rapid responses, or just noticing a vital that's off and going to communicate that with a nurse, and that could potentially turn into a rapid kind of situation, or code. We get codes, and using your strength for compressions. I've already done that on plenty of occasions. So just don't underestimate your role. Sixth thing, this is more so advice than it is like a mandatory thing. I mean, all of it's advice, of course, but just I wouldn't recommend dating on the unit you work on. These women are your sisters and colleagues. I prefer that you keep it professional and don't eat where you play, so to speak, or there's a term for it. Don't eat where you play, whatever. Because it can get sticky, man. Be a green flag. Be a safe space for these women to feel like they're not worried about getting flirted with or hit on or sexualized. They already deal with that enough with patients who are perverted or out here in the world. So give them a reason to feel safe with their CNA brother. If you're a nurse, your nurse brother. If you stumble across this, your nurse brother. I'm sure any woman that stumbles across this video will appreciate and understand what I'm saying when I say it's good to feel that a man's a green flag and you can kind of let your guard down and not worry about being sexualized. So that's just my 6 point. Anyways, guys, go out there and crush it. If this is something you're considering, I highly recommend being a CNA first before you pursue nursing. I think it gives you a good understanding of the kind of dance that a nurse and a CNA does when you finally do become a nurse. My wife's a nurse, and she gives me advice all the time on things that I could be looking for and improving on as a CNA to help other nurses. So, keep in mind you're there to assist your nurse and be hands-on. That doesn't mean that she can't get in there and get dirty with you. It's just as much her patient as it is yours, but you're definitely there to assist. That's why your job description says nurse's assistant. Don't get it twisted. You're not the nurse. And I gotta say that sometimes because I know some CNAs act like they don't want to do certain things because they feel like the nurse is, even if she is not as tied up as you think, just knock it out for her. I'm not saying get used and abused, but we're there to take the pressure off of them. So if they need to go run and do something that you don't feel is important, just do it anyway. Do your part, do your job, man. You got this. Go be great. See you guys. I'm out. Say bye, Evie.